Hey everybody, welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thanks so much for being with us today. We're here every Monday morning talking about topics that are aimed at making you smarter, healthier, and happier. And today we're talking about workplace safety and health. Frankly, there is no better time, no more relevant time to talk about this, as many of us go back to work if we've been at home because of the global pandemic caused by COVID-19. Maybe someone you know is in that situation and a little anxious about going back to work, or maybe you or someone in your family has been working this whole time at an essential job. So we decided it would be a great time to bring in one of the international leaders in this field, the American Industrial Hygiene Association. Their work is to basically practice the science of anticipating, recognizing, evaluating, and controlling workplace conditions that may cause illness or injury to workers. Joining us live today from Ohio is the president of AIHA, Kathleen Murphy. Kathleen, thanks so much for being with us.
Thanks so much for having me, Anna.
We've had a flood of questions come in because, as always, we post about the interviewee and the topic we'll be discussing in advance on all of our social media accounts. And I wanted to start with some questions that we did get from folks who are concerned about their own health and safety. Bill, for example, on Facebook says that he has allergies and trouble breathing through masks. Can he be mandated to wear one? He doesn't specify whether he's talking about in the workplace or just in public, but maybe you can tackle his question either way.
Yeah, so I think what I'll do is I'll talk first. I know that there's often a lot of confusion just on terms. What do we mean by a mask? What do we mean by a respirator? And so a mask is something that you put over your mouth and your nose. And its primary purpose is to protect other people so that you don't sneeze or cough and have droplets that could be contagious get to other people. Whereas a respirator is a face piece that actually has a known amount of filtration and is designed to protect the wearer from outside. So either in this case, the virus, in many cases, dusts or other chemicals. And so in the workplace, if your employer requires you to wear a respirator, then they are also required to have done a health assessment on you, and you would need to have clearance. So if someone had underlying health conditions which made it unsafe for them to wear that kind of a device, they would not be wearing one. Now,
That
when you're
is
talking
perfectly
about
understandable.
yeah, and when you're out in public, if it's just a mask to protect other people, that's really driven by what the states are requiring or those individual businesses that you're trying to enter. So,
Interesting. So, as people go back to work, I've talked to friends that are nervous. They're hygienists, they're in other occupations that have been closed down for several weeks here. And, they want to make sure that they're taking the proper precautions, that their employers are taking the proper precautions to protect them. Someone on Twitter wanted to know, is an employer required to provide PPE, which would be personal protective equipment, for free under OSHA's PPE standard? This person says they've seen people quoted about being required to buy their own PPE, and my first thought was that if I worked at OSHA, I'd start sending out nasty letters to the jerk employers.
well, I can't control whether OSHA will send out nasty grams, probably not. But what I can say is that OSHA does have regulations on personal protective equipment, and they are very specific about when an employer must pay for it and when an employer does not need to pay for it. Generally, if it is for use just in the workplace and it's for an individual, the employer is required to provide that. If it's for protection against exposures in the workplace that have been measured and are high enough, once again, OSHA would mandate that the employer provide those at no cost to the employee. Some exceptions to the rule, which aren't really that relevant in a pandemic that we're facing right now, are things like safety shoes, where you may be able to wear those out of the workplace, using them to mow in your backyard and things like that. Then the employer is not required to pay for them, and a few other specialty items like that. But generally speaking, if the employer requires it, they must pay for it.
Are there some fundamental protocols that cut across the board that you want to mention here? I know the type of protection and best practices vary widely by industry, but off the top of your head, are there certain things that you think employers really should be keeping in mind as they move forward with reopening businesses?
So I appreciated your introduction about the AIHA and what we stand for. And one of the things that we use as a guiding principle is what we call our hierarchy of controls. And it says the best way that you can protect employees' health, or safety for that matter, is to eliminate the hazard. If you can't eliminate the hazard, then you want to try to use engineering controls to reduce those exposures. So those are things like ventilation systems, guarding on machinery. If you can't do that, then you move to personal protective equipment or work procedures. Exposures versus just having to control them in some way. So if you can make sure that people are practicing appropriate social distancing, therefore we're expecting that there's not an exposure to, the virus, because you're not passing it from person to person, as opposed to when you go to a grocery store or some retail establishments, you see that they've put a panel in front of them. So that would be more of an engineering control. So you would prefer that you never had to get within 6 feet of the cashier, but that's unreasonable, so you'll go down to the next step. So that's, I think, just broadly how we would like them to look at it. And the last piece should be looking at, can I give them a mask? Can I give them a respirator? Can I give them gloves? Sometimes you'll need that, but you'd want to see, can we just use social distancing or other preventative measures first?
It's interesting. You mentioned engineering. That came up in one of the messages that came from an expert show, Insider, who asked what role could engineering solutions, specifically new ventilation standards, play in reducing viral transmission in elder care or other small facilities that are only partially regulated by OSHA?
Yeah, and I thought that was a great question, and I'll provide the references, but the two that I think are probably best are, I found one from OSHA, their Voluntary Protection Program website, so OSHA VPPA, and then one of our sister organizations that looks at all things ventilation is ASHRAE, so ASHRAE. And they both have really, really good guidance documents. And the ASHRAE is probably 45 pages long. You can find it easily on their website. And they talk about how you evaluate different kinds of workplaces, because clearly you have more risk in a healthcare setting than you would in most other environments. And so they talk about, first thing you want to look at is how many air changes per hour do you have in the area. And so in smaller workplaces, many times you'll see the guidance simply, if you can, leave the windows and doors open, because that's making sure you have a good exchange of air. In other settings, there are filters that can be added to your ventilation system. HEPA, which you'll hear people talk about HEPA filters. So those are designed to take out particles down to about 5 microns, which is pretty small, but viruses are extremely small. So they have yet even a higher level protection that you can install. Those can be installed on residential or commercial HVAC systems. So you'd want to talk to either your building manager about that, or if you have an HVAC contractor that you could talk to and see, can they install those. And the last kind of layer of protection there, particularly for healthcare settings or laboratories or things that are working with viruses, is that you can UV light. And I think we've heard this in the news. UV light is effective and more effective in certain ranges. You can actually have a UV device that's added so that before the air is recirculated, all of it goes through there and it will either disable or kill most bacteria or viruses. So it works in some cases to make it so it can't reproduce.
That's fascinating. You know, I want to mention this is important. Kathy will be referencing a lot of different things. She's very fact-based and science-based in her assessments and her advice. As always, we will create a tip sheet that summarizes the key points of the show and provides links to the information that she is referencing, so that people don't have to feel like they need to write it down right now. They can go back and check our website for that later. I want to thank everybody that is joining us live right now via Facebook and Twitter. Tony says that she is a self-employed hairstylist with shipping of PPE, personal protective equipment, taking months to reach her. She is still having a problem acquiring all of the new PPE. That is tough. Unless you have a supplier that already has it in stock, that may be tough to do. She wants to know what's going to happen when she needs to reorder all of the PPE that she's used. Side note, she believes it's too early for salons to reopen. She literally stands, just inches away from clients. And the government is now asking us to run our salons like medical offices. What advice would you have for Tony?
So one of the things I would say is we get lots of questions. We hear lots of questions from particularly small and medium-sized businesses where you don't have access to experts. And so AIHA has created a website where there's lots of information, including practical, what do we need to do to go back to work safely? And, very cleverly named, return to work safely. So once again, we'll also provide the link to that. And one of the documents that is in there is actually for salons. And so some of the things that you would want to think about is, do you have your patrons wearing masks as well as your stylists? Can you have them sitting every other seat? I know personally, my salon, I haven't been fortunate enough to get back in for my appointment yet, but they've sent me all the rules. One of the things they've said is they're not going to allow any blow drying of hair, just in case there would be any virus. That would be a way that, you could spread it pretty readily. So I think that, you want to think in terms of how do you limit the number of people that are in a salon at any time, so that you can, as we said before, try to make sure that we're eliminating the hazard by keeping people 6 feet apart. Clearly, the stylist and her client or his client can't be 6 feet apart. So can you use, a facial covering on both parties? That significantly reduces, if one party is wearing it, it's a good reduction. If both parties are wearing just a face covering, it's a really significant improvement there. And one of the things that they've shown that lives on the longest is actually money. So to the extent you can, if you're in a salon, try to get your patrons pay via credit card or something, because you can wipe a pen down. You can't really wipe down bills. So that's probably for most small business owners, if you can, go to a payment system other than cash. That would be a good start. But like I said, I do understand it's frustrating, and not all patrons are excited at the thought of having to wear a covering on their face, but it is a really good way to reduce the risk to your employees very significantly.
You may or may not have the answer to this. Do you see the supply side of PPE improving in the next few weeks or months?
I do, actually. I know that you see a lot of the major personal protective equipment suppliers are ramping up. They're making personal protective equipment in locations that didn't previously. I used to live in Arizona. I know that one of the PPE suppliers there had a visit from the president recently because they had, created a whole new manufacturing setup there. So I think all of the supply chain is really ramping up to meet those requirements. If you're not looking at a respirator, but you're looking at a face covering, I know a couple of weeks ago when I wanted to go online and order it for myself, there was a delay. Now you can go on any of your favorite locations online, and I had no trouble having one shipped the same day. So I think that many of those kinds of things, and I'm seeing the sanitizers back in my grocery store on the shelf. So, it's taken a while, but I do think that the supply chain is starting to catch up. And I think that's probably why businesses are attempting to reopen now, because nobody wanted to put their employees or the public at risk.
Yeah, you can really appreciate the tension there, the tough decision making on the behalf of small businesses, because they want to work, they want to have their employees employed and working and whatnot, but also not put anybody in jeopardy and be safe in the process. Something else that Tony mentioned was having to take the temperature of the clients as they come in. Basically, again, running her salon like a medical office. What is your thought on that? Can employers actually require that employees have their temperature taken before they enter the building to work that day? Can private businesses require that customers have their temperatures taken before they enter the premises?
It's a really interesting discussion and very confusing because every state is setting the requirements a little bit different. And so I know in my employer, they're going crazy just trying to keep track of what all the rules are in all the different locations. So if your state requires it in order for a business to reopen, then yes, they're going to have to do that. As far as can a business require its patrons to do so, that really becomes part of the relationship between, the business and their clients. So there's not a legal basis for that unless the states have said that you need to as a condition of reopening. One of the other things that some businesses are doing instead is just doing a basic questionnaire and asking people to self-report. Have they been out of the country? Have they been exposed to anyone that they know has COVID-19? Have they had a fever? In lieu of actually doing the temperature screening. I know that for quite some time, thermometers have been very difficult to come by as well. When you talk that, I don't think of a thermometer as PPE, but they've had the same issue in the supply chain as many of the others. So I think that may dampen people's enthusiasm for doing temperature screenings. And then you have to make sure that you have someone properly trained to do it, and proper sanitization, if it's one that comes in contact with the individual. So it may sound simple, but before you would want to require that as an employer bringing your employees back, you want to make sure you can do it properly.
Well, and kind of the follow-up question to that is, can an employer, and you may have the same answer that it really varies so much from state to state, can an employer require that an employee submit the test result that says, hey, I'm COVID-19 free?
Well, I think the first question is, would the individual even have had access to a test? Because we know that not everyone that wants a test can get one. And the second part of that is the test results are covered under HIPAA, which is the Health Privacy Act. And so to ask for test results, they're going to have to make sure that they have capability to meet all of those HIPAA requirements. And so once again, most small employers aren't going to have a nurse or a doctor or a place where they can store those records appropriately and purge them at the appropriate time frames. So I think that probably some large employers may do that. They may sponsor some of the testing if they have access to it. But I think that many places it's difficult unless you're symptomatic to even be tested today.
Ronald had a follow-up question to your comment about hair dryers in salons. He says he understands the concern of using a hair dryer, but he was under the impression that heat also kills the virus. Your thoughts, please, on that.
Well, sufficient heat can kill the virus. I think that the concern with hair dryers is just the amount and volume of air that's coming out of that, and depends on whether you have it on a heat setting or you have it on a cool setting. So I think that in an abundance of caution, many salons have just chosen not to use a hair dryer. So, and I think others may, if you have the space, may tell customers they can dry their own hair if they would choose to do that. Particularly some places in the country where maybe it's not as warm yet as it is in others.
Right. This was an interesting one. It came in via email from somebody who wanted some anonymity, who says they're 60 years old, purchasing manager at an acute care hospital. Their office is frequented by staff members all day and even can be through the night. Not a lot of traffic, but it's sometimes 3 to 4 people or more. This person had a very successful organ transplant 6 years ago and is still on anti-rejection meds, which suppresses their immune system. That being said, this person has a poor immune system to fight off the virus. They've been working from home since mid-March. They know they have to return to work, but would like to know what they can expect from their employer to ensure their safety, isolation from the ER staff and staff in general. This person understandably is very concerned and anxious about returning to work because they simply cannot afford a COVID exposure.
So I think the important thing here is, first off, with my and income, you're having to return to work as soon as others, and if so, provide you with a true respirator, because then you will be protecting yourself, not wearing a face covering, which is really meant to protect others. So I would, if I were you, I would try to have that conversation and see, can they provide you with that higher level of personal protective equipment.
Kathy, I apologize because of technology. Your answer was slightly garbled. Can I go back and re-ask that question again? Again, this is for
Please,
the.
please do, and I apologize.
No, yeah, I mean, I think there are just a lot of people, probably doing Zoom calls and conferences and using the internet right about now. But I want to make sure that your answer is well understood, because there may be a lot of people in that same position.
So what I said is that I think that if I were in that position, the first thing I would do is try to have a conversation with my manager, my employer, and make sure that they understand what the concern and what your situation is, and ask first, can I have more time to work from home so I can protect myself? And secondly, if not, can you please provide me with a true respirator so that I can protect myself, not just a face covering, which would protect others.
That makes total sense. Again, I want to thank everybody who is tuning in. People who aren't necessarily, working, they may be retired, but people who are just interested in going back and making use of services like gyms. Melania, for example, who's listening from home, is talking about how scary it is, the idea of going and working out again at a gym or going to that Pilates class. Are there things that you would recommend for just members of the general public, and maybe in a more enhanced way people who are in the at-risk categories as they start to think about going out and resuming normal aspects of their lives?
So I go back the same as everybody in my profession always does to say, what can you do to avoid the issue? So I would want to know from my gym or other public location, a gym, you're usually a member. So ask them, what is their policy going to be? What is their enhanced cleaning schedule? What disinfectants are they potentially using? And what's going to be the responsibility of other gym members? And what's going to be the responsibility of gym employees as far as the sanitation? You can also ask them, how are they going to manage social distancing? And I would just say, if you're potentially in a compromised immune situation or other kinds of things, and you can't get a satisfactory answer, I think that's a pretty high risk. I mean, most experts have deemed gyms to be of a moderate risk if they're following the requirements. So you just want to make sure that they are actually having a good cleaning schedule and that there is a way for them to do social distancing.
You
And
mentioned
once again,
asking about the type of cleaning agent. I have no idea the differences between what is a good cleaning agent that's effective and one that is not. What would be the more specific question to ask around that?
So EPA, the Environmental Protection Agency, actually has a great website where they talk about what all the disinfectants are. And you can always go back in your own household. Probably the oldest and simplest is bleach and water, 10 parts of water to 1 part bleach. Now, when EPA allows people to market their product as a disinfectant, a surface disinfectant, you have to follow the directions on the label. And so sometimes people are really surprised. There are some products out there quite widely used, very effective if used, but they say you need to leave the surface wet for up to 4 minutes. So that's why I said make sure you know what the disinfectant is, and is it one that you have to leave on for a period of time and then come back and wipe it off? Because I know most people in the gym, they just do a quick wipe down and they walk away. So that's why I said you kind of want to understand. And if you have any questions, once again, we'll provide the exact location on EPA's website, because they have a lot of stuff on their website about where you can see the efficacy and directions on surface disinfectants.
That's fascinating. That's going to be a very robust tip sheet, I can tell, at the end of this process. There was a question that came in via Facebook from an essential worker, somebody who's been working this whole time in a manual labor type job, who is very frustrated that 2 complaints that this person has filed with OSHA have gone without even a response. What is your advice for employees who are trying to have a voice in this and trying to wave a red flag but feel like they're not getting anywhere?
So the OSHA complaint process is that in some cases she may not have had a response. It depends on whether, I think you said it was a she, he or she, the complainant, if they provide their information, so their name and a contact, many times, you could get a copy of what the response is. But typically the OSHA would probably start with a letter to the employer asking them to respond to the complaint. So the employer may have sent back information which, when OSHA reviewed, they deemed as appropriate. I think that if they did not provide that information and called and said, I know maybe you sent a letter and maybe you got, but here's really what it is, the situation, and ask again. I think it may be that OSHA thinks it was addressed. It may be that because of the pandemic, it's taking longer to get to complaints. I'm not sure where she is, and I don't work for the government, so but I know that they do have a process that they follow, and they do respond, ask employers to respond to complaints. And if they're very, very serious or repeat, then they may send an inspector out to ask more questions.
Any last thoughts, Kathy, before you leave us?
Well, I forgot at the beginning of that answer to say thank you to all of our essential workers out there who are making sure that we keep the lights on, our hospitals are staffed, all of those kinds of things. I really just applaud your going back to work. As I said, I think I'll go back to what I said, which is if you can avoid exposure, that's the best. If not, if we can use some kind of engineering controls, so either ventilation or barriers, then the personal protective equipment. And if you're concerned, we'll provide a lot of the resources that are available out there. So I think that caution is important. Fear, I don't think is effective in this situation.
I appreciate your guidance on this, Kathy. Thank you so much.
Thank you so much. I appreciated it.
And thank you for joining me for this episode of That Expert Show. As we've mentioned, we will be creating a robust tip sheet based on the information that Kathy was sharing. We will post that on our website, thatexpertshow.com. You can also watch previous episodes of our show on YouTube, and you can always subscribe to our podcast to get our free content that we provide. I'm on Apple iTunes, Google Play, Stitcher, Spotify, TuneIn. We have a great team of people that puts together this information for you. And please reach out to me on social media. I'm on Facebook, Twitter, and Instagram. Just look for Anna Canzano. I always enjoy hearing from you. I want to know your ideas for how the show can be better, the type of topics and guests that you want to hear about and hear from. It's really a two-way street. Would love your help if you could subscribe, like, comment, share, spread the word about this episode or others so others can find us. I appreciate you being part of the show. It is called That Expert Show, and it's where you help run the show.